Okay, so welcome back, everyone. I am so excited to be able to introduce Jason Resendez to you, who I've had the pleasure of knowing for a couple of years, who is the executive director of Us Against Alzheimer's Center for Brain Equity and the head of Latinos Against Alzheimer's Coalition. Jason is an incredible guy. He's in the top 20 influencers in Aging by PBS Next Avenue, and he's been involved in many peer-reviewed research articles talking about brain health and talking about inequities. And I think we'll see some of those publications when he speaks. And then we're also going to be joined, Jason's going to talk a little bit about the work of Us Against Alzheimer's and Latino Against Alzheimer's, especially in South Texas. And then we're going to be joined by Daisy Duarte, who is a caregiver advocate for the Latinos Against Alzheimer's Coalition. And she really focuses on the growing impact of Alzheimer's on the Latino caregivers. She was a caregiver for her mother, who passed away just a couple of months ago. And Daisy also tests positive for the gene linked to early onset Alzheimer's. We've had the privilege of meeting her a couple of times to get ready for this symposium. And so she and Jason will continue the conversation about how we can support families living with Alzheimer's and how important it is to be involved in research after Jason talks. So I'm going to turn it over to you, Jason. Thank you so much.
Hey, Jason. I just want to make sure you have the ability to share your screen. Let's ask him. There we go. Hi, Jason.
Hi. Great. Are you kicking it over to me?
Yes, you should have the ability to share your screen.
Oh, great.
Like to, and I can share them too if you.
No, I can. It's better for me to share because I made some final updates. But thanks so much for having me, for putting on this amazing conference and discussion, and so excited as a native Texan, and specifically as a native South Texan, to be part of today's discussion, to be alongside advocates like Myra, who I've gotten to know over the last couple years, and we've been able to do some joint writing, and just always in awe of her commitment to her family and her commitment to community and to sharing her story to drive action. So thank you to Myra and to all the other advocates that have shared their stories today. What I want to do is talk a little bit about the importance of health equity when we talk about Alzheimer's and its impact on the Latino community, and how this is playing out in South Texas and nationally. So we've talked a little bit about this throughout the day, the impact of Alzheimer's on the Latino community, and was really excited to hear Senator Resendez highlight some research that we did with USC, looking at the projected growth of Alzheimer's in the Latino community. And what we know thanks to that research, and also research that we supported at Johns Hopkins, by 2030, nearly 40% of all Americans living with Alzheimer's will be Latino or Black. The face of Alzheimer's is changing. Clearly, this is a disease that impacts everybody. We're all at risk for Alzheimer's and related dementias. But from a demographic perspective, we're going to see a tremendous growth in the number of Latinos living with Alzheimer's and related dementias. In fact, by 2050, as the senator pointed out, there'll be nearly 2.6 million, 3.1 million Latinos living with Alzheimer's, which is one of the fastest growing demographics in the Alzheimer's community over the coming decades. Currently, according to Medicare, there are about 12% of the Medicare population over the age of 65 is living with Alzheimer's related dementia. Despite this number, less than half of these individuals actually know about their diagnosis. So that we know that there's a tremendous growth in the patient population. There's a large number of people living with Alzheimer's today. Yet it's these communities that have the least access to a diagnosis, that have the least access to care services, and the least access to research opportunities. And so there are big disparities that this community faces when it comes to navigating the dementia journey. And a lot of these are structural issues, and we'll talk about that in a little bit. So we know the numbers in terms of the projected growth in the community. It's very hard and in fact impossible to calculate the toll that those numbers represent from an emotional perspective on this community. However, we can more easily calculate the economic impact that the disease takes on the community. And before I talk about that, I want to highlight, this is a photo that I love of someone you'll hear from in just a bit, Daisy Duarte and her mother, Sonia, who unfortunately recently passed away after a long battle with Alzheimer's. And so we're really grateful to have Daisy join us today. But throughout this presentation, you'll see photos of Daisy and her mom. It really, for us, it highlights the journey that the community faces with the disease and helps to put a face on these numbers. And so we're looking forward to talking with Daisy in a bit. But when we talk about the economic impacts of Alzheimer's on the Latino community, they're tremendous. This is the result of that growth that we just talked about in terms of the number of Latinos living with Alzheimer's. In fact, by 2030, we'll spend around $30 billion in Alzheimer's related costs. So direct and indirect costs related to medical care, related to institutionalized care, related to lost productivity. We'll see that grow to about $150 billion annually by 2060. And the cumulative impact, so the total amount of money spent between now and 2060 on Alzheimer's related costs in the Latino community alone is projected to reach $2.3 trillion. That's $2.3 trillion of Latino wealth wiped out by one disease, Alzheimer's. That represents a tremendous burden on this community, on the healthcare system, and our economy. We know that Latinos experience a major wealth gap in the United States, with median household wealth of being about $22,000 compared to about $163,000 in 2016 for non-Hispanic white Americans. That's a tremendous gap. And this is a gap that we've seen widen thanks to the financial crisis of 2008. It's also a gap that we're seeing widening because of the coronavirus. I know that's a theme that we're talking about. In fact, according to research from the Bipartisan Policy Institute, about 13% of Black Americans have left the workforce due to the coronavirus to provide caregiving responsibilities. About 14 to 16% of Latinos have left the workforce during the pandemic due to caregiving responsibilities. So this is a gap that's widening. As you've just seen with the economic impact of Alzheimer's, this will continue to widen this wealth gap. So this is certainly a health challenge. It's a health crisis in the community, but the other side of that health crisis, the other side of the coin is an economic crisis. And these numbers really underscore our need to promote not just solutions through cutting edge medicine and research, but also the importance of looking at social policy and advancing equity to support families as they navigate the Alzheimer's crisis. So I want to talk a little bit about COVID and how COVID really parallels a lot of these challenges that we see in Alzheimer's, particularly in Texas. So this is a map of COVID cases as of the middle of March. And you can see hotspots across the US, but particularly in Texas, you see South Texas as an area where we're still seeing a lot of burden of COVID-19 on the community. And now when we think about this from an equity perspective, we see some really striking data. So this is the Kaiser Family Foundation did an analysis of COVID-19 cases, deaths, and vaccination rates by race ethnicity. And what we see in Texas, that while 41% of the cases of COVID are among the Latino community, they represent just 23% of vaccinations in the state. When you compare that to the white population, we see that they represent 38% of the cases, yet they represent 51% of vaccinations. So there's a disconnect here. There's a need for really thinking through how we deliver vaccines. Before we had vaccines, it was about testing. We saw similar disparities in testing. How do we do this work equitably to ensure that these numbers are proportionate to each other, where we don't see these out of balance ratios in terms of utilization of accessible services. And certainly that's the case if we were to look at Alzheimer's data. Like I mentioned, Latinos 1.5 times more likely to develop Alzheimer's than non-Hispanic whites, yet the least likely to have access to a diagnosis, the least likely to be enrolled in clinical research. So we see similar equity gaps with COVID and with Alzheimer's. And if we were to do a heat map to look at the impact of COVID on Texas and the impact of Alzheimer's on Texas, we would see South Texas is hard hit. So the crisis that we're seeing play out in COVID is happening on top of the already existing Alzheimer's crisis playing out in South Texas. I just want to highlight, there's a lot of great resources out there. Many of them have been talked about today. I just want to put a spotlight out on the CDC and their guidance for older adults. You could go to this link and we'll make sure that Sarah has this for the resources. They have a number of resources for community-based organizations, for families, and for health systems to ensure that our COVID response is inclusive of older adults, particularly older adults who are at risk for chronic conditions and complex care conditions such as Alzheimer's and related dementias. So this is a really important resource because these are being released in multiple languages, not just translated, but developed with an eye towards cultural competency. So really recommend checking out the CDC resources as part of their Healthy Aging and Brain program to learn more about how to become more COVID resilient in these communities. So now I want to talk about South Texas. As I said, I'm a native South Texas. I was born in Alice, Texas, about 45 minutes south of San Antonio. In fact, the last trip I made before the pandemic stopped all travel, I live in Washington, D.C. now, was to the South Texas Alzheimer's Conference with all of the organizers of today's symposium. So it really has a special place in my heart. At Us Against Alzheimer's, the organization that I represent, we released a report late last year that looked at the counties that are most impacted by Alzheimer's among Latinos, Blacks, and non-Hispanic whites. And what we wanted to do is look at the similarities between those counties that are the most impacted versus those counties that are the least impacted, and to identify similarities and differences at the county level, particularly as it relates to the social determinants of health, things like access to exercise, income, insurance rates, access to quality and nutritious food, to understand what are the similarities and differences in counties that are highly impacted by Alzheimer's. What we found across the board was that socioeconomic conditions were generally worse in counties that were highly impacted by Alzheimer's compared to those counties that were least impacted among Blacks and Latinos. In fact, Black counties that were highly impacted had higher rates of poverty, both Black and Latino counties, higher rates of poverty compared to those counties with the least amount of prevalence, lower medium household incomes, higher levels of individuals without insurance, and less access to exercise opportunities. So these counties that are have a high burden of Alzheimer's among Blacks and Latinos tended to have worse social economic conditions. A lot of these social determinants of health shape your risk for diseases like Alzheimer's, for comorbid risk conditions like heart disease and diabetes. So we think it's important to highlight the connection between these social determinants and Alzheimer's. And not surprisingly, when we look at where those counties were, we see that South Texas was an area that was hard hit. So this is looking at community level disadvantage in South Texas. So this is a composite of a lot of those social determinant factors, looking at education, income, poverty levels, and providing a score based off of the most disadvantage relative to higher advantage based off of those factors. And what we see is that South Texas is highly disadvantaged when we're looking at a lot of those factors. And so, not surprisingly, when we looked at where were the counties that were most impacted by Alzheimer's among Latinos and Blacks, South Texas and Texas generally was one of the hardest hit states in the country. And so Starr County in South Texas had the highest overall prevalence of Alzheimer's among the Latino community. And so many of the counties that are highly impacted are within that South Texas region. And so the state senator highlighted efforts underway. Obviously, the University of Texas system, University of Texas Rio Grande Valley, have been very engaged in responding to this burden in South Texas. But there's much more that we need to do. When we did an analysis of NIA, National Institute on Aging, research centers and where they were located, what we found was despite the high burden in South Texas, there's not a single Alzheimer's disease research center in the entire state of Texas. There are federally supported programs for sure. The Biggs Institute has some of those. University of Texas Rio Grande Valley has some of those. But in terms of a full-fledged center that is a flagship for engagement, recruitment, for advancing cutting-edge research, those federal resources have not yet manifested in South Texas. So there's a huge need to fill these gaps in the state and in the region in order to advance access and to address a lot of the disparities that we've been talking about today. We also see, when we look at costs, we see high per patient costs in South Texas. In fact, about $3,000 higher than the national average. So we see one, higher prevalence, higher impact in South Texas, and that translates into higher Medicare costs. So all of this really builds a case for advancing equity, really thinking about this from a tailored engagement perspective. How are we developing programs that are not just tailored to individuals from different cultures, race, ethnicities, but from a regional perspective? How are we developing programs and strategies that are responsive to the realities of South Texas? And this is where that investment from the federal government, that investment from industry, from philanthropy, is going to be really critical to bending the curve that we talked about that growth that we project by 2040. If we don't want that to be reality, we have to really invest in the development of culturally sensitive interventions and programming and infrastructure. Investing in infrastructure in the region to support solutions to these challenges. And I think an important part of that conversation and of that development of solution is by listening to individuals who are impacted by the disease. So folks like Myra and why her role as an advisor to this initiative is so critical. Then also folks like Daisy, who I now want to transition into that conversation, if that works for you, Sarah, if we should just directly transition into the conversation with Daisy Duarte. Really excited to introduce Daisy here. I see her pop up now on the screen. So Daisy is someone that I've gotten to know over the last, I guess now what, 8 years, 6, 7 years, something like that, almost 8. It's gone by really fast because of the amount of fun that we have when we're together. I was in fact telling her before and telling Sarah, one of the worst things about COVID has been the fact that we're not doing this together in South Texas, because I would love to show Daisy the Riverwalk and all the great things that I love about San Antonio and the region. But so Daisy is someone I've gotten to know through her work as an advocate. Caregiver first, advocate second, but she's done an amazing job of weaving those two roles into one. And so with that, I want to welcome Daisy Duarte, and we're going to just engage in a chat, and then we'll open it up to conversations with others. So Daisy, we've known each other for a long time. You came to us because of an amazing story that you did that was featured in People magazine about your journey. So can we start there? Can you tell us a little bit about your journey as a caregiver? How did it start? And what have you learned along the way?
Well, thank you for having me, everyone. As a caregiver, I started 10 years ago due to my mom having a decline, and they thought first they thought she was depressed, and then they misdiagnosed her a year later and said she had CJD, which is Creutzfeldt-Jacobs disease, like a mad cow eating disease for humans. And after she was misdiagnosed, I was just doing research on it, and I couldn't find anything on it, just that people don't last more than 9 months with the disease. So I finally found a foundation out of Australia, a lady who had a foundation, and I contacted her, and she replied to me and connected me with someone in New York that was doing some kind of helping her out with the foundation out of the States here in New York. And then the lady named Maria contacted me and asked me to send her all my mom's MRIs and CAT scans, everything that I had, my mom's medical records. So I sent them to her, and she said that she would do some research for me to see if somebody could read her MRIs and everything. And she contacted me maybe a week later after I sent her the medical records, and she told me that there was a doctor based out of Wazoo University in St. Louis that specializes in Jacobs disease, and a neurologist that specializes in that. And so that was great because I live in Springfield, Missouri, which is only 3 hours away. So I traveled out to St. Louis, and we took my mom, and he already had her records, and he saw her CAT scan and her MRIs, and he told me he had good news and bad news. And he said, which one did I want first? I said, give me the bad one first. And he says, well, I'll give you the good one. And the good one was that she didn't have Jacobs disease, which that meant she was going to last a lot longer than 9 months with me. But then the bad one was that she did have early onset Alzheimer's. So that was a relief for me, because 75% of my family has been diagnosed or is living with Alzheimer's. So I already knew Alzheimer's ran in our family. Never thought my mom would have it, but those are the odds. And when he told me that, I was more relieved because I knew about the disease already. Didn't know 100% like what I know now, but I knew a little bit about it. And we took it from there. That same day, he asked me if I wanted to join a clinical trial, to take some time and think if I wanted to join a clinical trial to see if I had the genetic mutation. And I said, sure. And he says, no, take time to think about it and then get back with me. And I said, there's nothing to think about. My mom already has it. If I have it, I want to take a stance for this disease. Or even if I don't have it, I want to be my mom's voice. And so I did. And 3 months later, I took the blood tests, and I do have the mutation. I found out like 4 years into caring for my mom that I do have the genetic mutation, and I'm guaranteed to have Alzheimer's by the age of 65. But the other good thing, I'm one of the few Latinas that are involved in a clinical trial. Do you want more?
Oh, it seemed like you're going to go into it. No, I will talk a little bit more about the clinical trial participation. But thank you for, sharing, your journey. And this is one of the things that is so common in the Alzheimer's experience generally, but I think is seen acutely in communities of color. This back and forth around diagnosis and misdiagnosis, and as I said before, nearly 40% of Latinos with Alzheimer's don't even know that they have that diagnosis. And so there's just so much work that we need to do in terms of helping people access this diagnosis earlier and to make sure that it's accurate and that it's timely because of the need to plan and to make arrangements and also to take action. I mean, I think you highlighted how you're taking action, right? Everyone deserves the opportunity to plan for action, to be an advocate. The other thing I love about your story is, and another way that it really captures some of the data that we see in the caregiver population, is that while folks don't really see this enough, nearly 15% of dementia and Alzheimer's caregivers are millennials, young people who are either pitching in to help a family provide care, or in the case of the Latino community, which has a higher rate of millennial caregivers who are serving as the sole caregiver of their loved ones living with dementia. There's just so many roles that young people play. And I know there's a special young person in your life that has helped to provide care. Your nephew, Martin, can you tell us a little bit more about Martin and sort of how he's been a part of your care team and how that evolved?
Well, 5 years after caring for my mom by myself, we were having a family gathering at my house, and my nephew saw how I was struggling to carry my mom because she was no longer walking. So I had to carry her from the recliner to, pick her up and put her in her wheelchair. And my nephew, he was 16 at the time, and he was in high school. And he just told me, he's like, you need help. And I said, well, I have no one to help me. And he's like, well, I'm going to move in with you. And I said, well, ask your mom first before. I didn't want no fights with my sister. So he asked her that night, and she says, as long as you stay in school and you don't drop out and you do bring good grades, you can help. And so that same night he moved in with me, and we started the journey of teamwork. He went to school. I would wake him up every morning, take him to school, and he would come after school, and we figured out he wasn't working at the time, so we figured out a schedule where he can get a job and I could stay working at my sister's restaurant. My sister owns a Mexican restaurant herself, and we started splitting up schedules where he could work 3 days and I could work 3 days, or vice versa. We just tried working our schedules out. And since he moved in here, he's, even till now, my mom passed away in January. I'm sorry.
It's okay. We're here for you, and we know it's been a tough journey. And
he's been my backbone. He comes, he still checks up on me. Like if my mom was still here, he doesn't live with me anymore, but he still checks up on me.
That's it. I love that. And, I love that someone in the chat, you're getting a lot of support in the chat saying, don't apologize. And I think that's exactly right. This is what we're here to talk about. And we all understand that this is not a dry conversation, right? We bring our full selves to these conversations. And that's what I love about you, always bringing your full self to these talks. The other thing I love about that story is how it challenges the perception of young people, right? As lazy, as self-centered. I mean, I think and I'm saying, I know I'm a millennial, so I'll just be full disclosure that I'm on the older spectrum of the millennials, but I think we get unfairly labeled as being, self-centered. But there's so many young people, and I think this has been the history of the disease, right? So many young people who are enlisted voluntarily to be part of care teams. And Martin is such a great example of that, and the fact that he's still part of your care team. right? We all need caregiving, even if we're, not providing that care for our loved one anymore, it's still a part of our lives. It'll always be. And I think that is beautiful to hear that Martin is still engaging and still part of that process for you. I think the other thing it highlights, and something that we see when we talk about the importance of culturally tailoring supports, is that means a culturally tailored from a race ethnicity perspective, from a gender perspective, but also from an age perspective, right? We know more and more young people are providing care. We have the data that shows us that, particularly young people of color, yet there are so few resources for young caregivers. That's why we partnered, for example, with Hilarity for Charity. Seth Rogen, the comedian, he has a charity. And they have Zoom support groups for young people because of how hard it is for young people to connect with other young people who are doing this work and providing this care, and how important that is for support. So I think Martin's story highlights the importance of that, and thank you for sharing that. I have a couple other questions, but I also see, so you tell me, Sarah, I see Councilman Manny has joined us. So if that is something that we need to, I know how schedules with electeds
You
are.
have time, please.
Okay, great.
Yeah, you have a bit of time. Go on.
Okay, perfect. But glad to see you with us, Councilman. So the other thing I think has been a part of everybody's experience right now, caregiving, has been COVID and the impact of COVID on caregivers. So Daisy, can you tell us about how COVID, while you were caring for your mom, how that changed your routine and how you adapted to providing care in the age of COVID? How did that impact your ability to, I know you were working at some point at a restaurant, and how did COVID change all of that for you, and how did you adapt?
Well, when COVID hit, I was working just part-time, but I had to quit working just to make sure my mom didn't get it, because she was at her end stages. So I made sure that I didn't work. My family could not come over. They would have to see her through FaceTime or calling her. And she didn't talk. She was nonverbal or anything, but as long as she heard their voice, because I always believe that even though they're not talkative, they don't talk or they don't move or they're just in bed, they still hear. I'm a true believer in that with people with Alzheimer's. So it was, honestly, it was like the whole world was on lockdown, but we were really on lockdown. I would go to the store and get groceries and just come back home. I didn't communicate with no one unless it was on the phone. My whole world, like the world shut down, but literally my world shut down because I had no communication. I'm a very interactive person. I like to be around my friends and everything. So being on the phone, Zooming was the only way to do all that. But that, the income was killed me because I wasn't, being a server and making tips. I wasn't doing that anymore. But I lived off my mom's pension for that whole year to make ends meet. And by the grace of God, we made it. So.
Yeah, no, thank you for sharing that. I think that, again, you brought to life some of the statistics that we talked about, right? Knowing that 16% of Latinos left the workforce to provide caregiving during the pandemic, you're part of that. And underscores the importance of social policy in supporting dementia caregivers and supporting caregivers across the board. So we are big advocates, and Daisy's been a part of this, of paid family and medical leave, which has unfortunately not been part of any of the dementia COVID relief packages. When we have seen paid family leave, it's been for new parents, which is great, that's important. But we have to think about caregivers of all kinds across the lifespan. So from young parents to young people providing care for family members living with conditions like Alzheimer's and related dementias, and then folks like Daisy who want to work, who need to work to make ends meet, but caregiving is essential. And so how do we balance both of those? And Daisy, you've tried to do that across your life, and so we're grateful for your work and for you sharing your story so that we can advance those kinds of policies. The other thing I want to talk about briefly is, as you mentioned earlier, another way that you are bucking the trend when it comes to these statistics. So I talked about all the ways you fit into the box, and even though you definitely don't fit into any boxes, that's why I love you. But one of the ways that you buck the trend is through your participation in research. And so can you tell us more about what that's looked like for you? Why is it so meaningful to be enrolled in Alzheimer's clinical research? And would you encourage others to do it?
Well, it's important for me to be in clinical research because I refuse, like I said earlier, 75% of my family has been diagnosed or is living with Alzheimer's. And I refuse to be another statistic. And if I am a statistic, I want my voice to be heard, and I want to be involved in finding a cure. And that's my main motive. My super main motive is I don't want to see my nieces and nephew go through what I went through with my mom. I would like them, if there's a cure within 10 years, that it'll be the biggest blessing. I have faith that we will find a cure here soon, but it takes, because it works for an African American or it works for a Caucasian, it doesn't mean it works for a Latino. So we need more Latinos to be in clinical trials so we can find a cure for our people. I mean, I really have faith that if more people got involved, we would find a cure sooner.
Yeah, I thank you for that. I mean, I agree with you. I think it is one of those decisions that people need to make on their own, but should definitely do the research, because, you know, the first person cured of Alzheimer's will be someone enrolled in a clinical trial. The first person to receive the COVID vaccine was someone enrolled in a clinical trial. So this is an important way to access cutting edge therapies and therapeutics that disproportionately impact our communities. Latinos, again, 1.5 times more likely to develop Alzheimer's. Blacks, 2 to 3 times more likely to develop Alzheimer's. You know, everybody needs access to treatments. But one of the best ways to ensure that those treatments are going to work for everybody, as Daisy said, is to be part of that process. There's a lot of issues with the process, but we can make them better and are making them better through the kind of work that Daisy's doing and through that research participation. So thank you for that. Last question, and then I'll turn it back over to Sarah. There are a lot of folks on here that have been on this journey, that are on this journey now. You know, you're in a different part of the journey. What advice do you have for caregivers looking back in the, you know, care that you provided, in the advocacy that you've done? What have you learned? What advice do you have for others?
Well, my advice is to get involved in, you know, if it's a family, if there's a mutation going around in the family, get involved in clinical trials. If it's not a mutation, and just, you know, the one thing I will say, and I always say this, is care for your loved one like you want to be cared for. Treat them the way you want to be treated. Alzheimer's is a disease that from starting to end, from the beginning, they get you so mad. In the middle, they get you even worse. You have a very short fuse, but towards the end, it's more of a mourning process once they're fully gone, you know? And so to me, I would tell anyone that's caring for a loved one with Alzheimer's is treat them with love and respect. They're still there until the Lord takes them. Treat them with love and respect.
Great. Thank you so much, Daisy, for sharing your story and for your work as an advocate, as a research participant, and above all, for your work as a caregiver. So thank you, and for joining us. Thanks, everyone.